Top 7 vitamins to strengthen your legs. Imagine waking up every morning with legs that feel strong, steady, and full of energy. No more muscle weakness, no more painful cramps, and no more worrying about balance or falls. If you want to stay active, independent, and confident as you age, the secret lies in nutrition. And today, we're revealing the 7 most powerful vitamins and minerals that will help keep your legs strong and unstoppable. These nutrients don't just support your muscles, they also protect your bone density, improve circulation, and enhance coordination. They can make a huge difference in how you move and feel every single day. So, whether you love strolling through the park, dancing, gardening, or simply staying independent in daily life, this is for you. Before we start, I'd love to know where you're joining from. Drop a comment below, ask your questions, and make sure you hit the subscribe button with notifications turned on so you never miss the best health tips. Let's build a healthier, stronger future together, starting with the first and most important nutrient for leg strength, vitamin D. Vitamin D, why it matters and deficiency risks. As we age, our bodies go through inevitable changes. Muscle mass declines, bones lose density, and movements that once felt effortless become more difficult. One of the most overlooked reasons behind this decline is a deficiency in vitamin D. It's not just about brittle bones. Vitamin D plays a fundamental role in keeping legs strong, balanced, and functional. Research has consistently shown that low vitamin D levels are linked to muscle weakness and a significantly higher risk of falls. In fact, a study in the Journal of Clinical Endocrinology and Metabolism found that seniors with adequate vitamin D had stronger muscle fibers, better coordination, and improved balance, making them less prone to fractures. On the other hand, those with deficiencies experienced accelerated muscle loss, making even simple activities, like climbing stairs or standing up from a chair, more challenging. Vitamin D enhances protein synthesis, improves neuromuscular communication, and supports fast-twitch muscle fibers, the ones responsible for quick reactions and balanced recovery. Without enough vitamin D, these fibers deteriorate, slowing reaction time and increasing injury risk. To make matters worse, as we age, our skin becomes less efficient at producing vitamin D from sunlight. Many older adults also spend less time outdoors due to mobility limitations or concerns about skin damage. The result? A widespread deficiency that silently erodes muscle strength. Vitamin D sources, supplementation, and extra benefits. Vitamin D isn't only about muscles and bones. It also reduces inflammation in muscle tissues, helping relieve chronic pain, cramps, and stiffness. Many seniors dealing with unexplained leg discomfort might be surprised at how much better they feel after optimizing their vitamin D levels. Ignoring deficiency can lead to osteoporosis, fractures, heart disease risk, cognitive decline, and weakened immunity. The good news? Raising vitamin D levels is straightforward. Sun exposure, just 15-30 minutes of direct sunlight on arms and legs a few times per week can help, ideally in the morning or late afternoon. Dietary sources, fatty fish like salmon and mackerel, fortified dairy or plant milks, egg yolks, and mushrooms can all contribute. Supplements for most older adults, 800-1000 IU daily is recommended, though those with severe deficiencies may require higher doses under medical guidance. If you're unsure of your levels, a simple blood test can tell you where you stand. Doctors now routinely check vitamin D in older adults, given its critical role in preventing falls and fractures. After vitamin D, the next key nutrient for strong legs is calcium. Most people think of calcium as just a bone vitamin, but its role is far greater than that. It is the main mineral that gives bones their strength and density, but it also plays a critical role in muscle contraction and nerve function. As we age, our bones naturally lose calcium faster than they replace it. This is called age-related bone loss, and it leaves the skeleton weaker and more prone to fractures. For seniors, the most dangerous of these are hip fractures and femur breaks. These injuries are not only painful, they can be life-changing, leading to months of recovery or even permanent loss of independence. Calcium also acts like an electrical trigger for muscles. Every time you take a step, calcium ions are released into muscle fibers, enabling them to contract. Without adequate calcium, your muscles may cramp, feel weak, or fail to generate the power needed to maintain balance. That's why people with calcium deficiency often experience frequent leg cramps, sluggish movement, and reduced endurance. You can get calcium from a variety of foods. Dairy products like milk, yogurt, and cheese are rich sources, but you don't have to rely on dairy alone. Leafy greens like kale and bok choy, tofu, sardines, almonds, and fortified plant milks also provide significant calcium. The important thing is variety, including multiple sources in your diet, helps maintain steady absorption and bone strength. While food is the best source of calcium, some people, especially those with dietary restrictions, may not get enough from diet alone. In that case, calcium supplements can help. However, more is not always better. Excess calcium from supplements can lead to problems like kidney stones, digestive issues, or calcium buildup in arteries. To make the calcium you consume more effective, pair it with vitamin D, which helps your body absorb it more efficiently. And don't forget movement, weight-bearing exercises like walking, light jogging, or resistance training. Stimulate bone remodeling and help direct calcium to where it's needed most. Without exercise, even adequate calcium intake won't fully protect your bones. The recommended daily calcium intake for older adults is about 1,200 milligrams, ideally from a combination of food and supplementation if needed. When you consistently meet your calcium needs and stay active, you're not just protecting your bones, you're preserving your mobility, confidence, and independence well into your later years. While much of the conversation about leg strength revolves around minerals like calcium and protein intake, few people realize that vitamin B12 is equally important, especially for nerve and muscle communication. Pool 12 keeps your nerves healthy and ensures that electrical signals from your brain travel efficiently down the spinal cord to your leg muscles. Without it, the signals can become weak, slow, or disrupted, leading to leg weakness, unsteady walking, and a loss of coordination. One of the most common symptoms of B12 deficiency is a feeling of heavy, tired legs, often accompanied by numbness or tingling. The problem is that B12 deficiency is incredibly common among older adults because it requires adequate stomach acid and a special protein called intrinsic factor for absorption. As we age, stomach acid production declines and digestive conditions like gastritis or acid reflux, plus long-term use of antacids can further reduce absorption. If left untreated, a B12 deficiency can cause permanent nerve damage, affecting balance, reflexes, and mobility. Many seniors who think their walking difficulties are just old age are actually dealing with a correctable nutrient shortage. The good news is that restoring vitamin B12 levels can make a dramatic difference. Seniors who correct their deficiency often notice improved energy, coordination, and overall leg strength. B12 is found almost exclusively in animal products. Lean meats, fish, eggs, dairy, and shellfish, like clams and liver, are excellent sources. For plant-based eaters or those with absorption issues, B12 fortified cereals, plant-based milks, or supplements are essential. B12 is water soluble, meaning excess amounts are excreted in urine, so it's generally safe to supplement even at higher doses when needed. In some cases, doctors recommend B12 injections for people who cannot absorb it through food or pills. Regular blood tests are the best way to monitor your levels. And remember, strong legs aren't only about muscle mass, they're about how efficiently your nervous system sends signals to those muscles. Maintaining healthy B12 levels is one of the most overlooked yet powerful strategies to keep your legs responsive and steady as you age. Every time you take a step, magnesium is working quietly behind the scenes to make it happen. This mineral acts as a master regulator for muscle function, allowing muscles to contract and relax smoothly. Without enough magnesium, muscles may spasm, cramp, or become stiff, especially in the legs. One of the most common yet often overlooked signs of magnesium deficiency is restless leg syndrome and frequent nighttime leg cramps. Many seniors experience sudden, painful contractions in their calves or feet that wake them from sleep. These aren't just uncomfortable, they're a signal that your muscles aren't getting the support they need. Magnesium also supports bone strength. While calcium often gets the spotlight for bone health, it cannot do its job effectively without magnesium. This mineral helps guide calcium into bones rather than allowing it to build up in soft tissues where it can cause stiffness or even contribute to artery calcification. Studies show that people with higher magnesium intake have stronger bones and a lower risk of fractures as they age. Unfortunately, magnesium deficiency is widespread because it's easily depleted by stress, poor diet, and certain medications such as diuretics, acid reducers, and some blood pressure drugs. Over time, this depletion chips away at your strength, endurance, and flexibility, making daily activities more tiring. The benefits of restoring magnesium levels can be felt quickly. People who have dealt with frequent cramps, stiffness, or sluggish legs often notice relief within days to weeks of improving their intake. Rich dietary sources of magnesium include leafy greens like spinach, nuts, and seeds such as almonds and pumpkin seeds, whole grains, legumes like black beans, and even avocados. If you find it hard to get enough through food alone, supplements like magnesium citrate or magnesium glycinate are well absorbed and can be very effective. Many older adults who restore their magnesium levels not only sleep better but also move more freely and feel more energetic during the day. Even balance and coordination can improve, since magnesium helps regulate nerve signaling to the muscles. In short, think of magnesium as your movement mineral. Without it, your muscles struggle to perform smoothly and your legs lose the resilience they once had. Next is potassium, an essential electrolyte that plays a huge role in muscle control. Potassium helps balance fluids inside and outside of your muscle cells, and without it, your muscles may contract involuntarily, leading to cramps, tremors, or stiffness. Have you ever gotten a sudden calf cramp after getting out of bed, or felt your legs tremble after standing for a while? Low potassium could be the cause. It's also critical for sending nerve impulses to your muscles, so when potassium is lacking, the communication between your brain and legs becomes less efficient, raising your risk of falls. Beyond muscle health, potassium helps protect your bones by reducing the acid load in your body. Too much acid can break down bone tissue over time. A potassium-rich diet can slow bone loss and lower the risk of osteoporosis, keeping your legs both strong and stable. Potassium is abundant in many delicious foods. Bananas are the most famous source, but sweet potatoes, avocados, spinach, beans, oranges, and potatoes with the skin on all pack even more. The recommended daily intake is about 2,600 milligrams for women and 3,400 milligrams for men, amounts that are easily reached with a balanced diet. Supplements are available but should be used cautiously, especially if you have kidney problems or certain heart conditions, as too much potassium can be dangerous. For most healthy adults, the best strategy is to regularly eat a variety of potassium-rich fruits and vegetables. Doing so will help your muscles work efficiently, reduce cramps, and keep your legs ready for activity at any age. While calcium and vitamin D are well known for bone health, vitamin K is the nutrient that ensures calcium ends up in your bones, not in your arteries or joints. It activates proteins that bind calcium to your bone matrix, making bones denser and more resistant to fractures. Vitamin K also supports joint flexibility and muscle coordination, reducing stiffness in the knees and improving balance. Leafy greens like kale, spinach, and Brussels sprouts are rich in vitamin K1, while fermented foods, aged cheeses, and egg yolks contain vitamin K2, which stays active in the body longer. Finally, vitamin B6, also called pyridoxine, is vital for nerve health, muscle repair, and red blood cell production. Without enough B6, your muscles may tire quickly, your legs may feel heavy, and your coordination can suffer. B6 is found in poultry, fish, bananas, potatoes, chickpeas, and fortified cereals. Together, these seven nutrients vitamin D, calcium, vitamin B12, magnesium, potassium, vitamin K, and vitamin B6 form a powerful foundation for lifelong leg strength, support your muscles, protect your bones, keep your nerves firing efficiently, and you'll stay mobile, confident, and independent for years to come.